Welcome to Discovering Health, presented by Covenant Health Plainview. Your host for the show is Chris Moore, alongside various medical staff and health-related professionals. For the next 30 minutes, Chris submits the questions to the professionals that you have emailed in and discuss the topics that you want to know about. Now it's time for Discovering Health, presented by Covenant Health Plainview and Chris Moore.
Good evening. You're tuning to 103.9 FM, The Pulse. It's 5 o'clock and it's time for Discovering Health, brought to you in part through the courtesy of Covenant Health Plainview and South Plains College. My name's Chris Moore, and joining me for today's program is Dr. Beau McCrory, who specializes in emergency medicine at Covenant Hospital Plainview. Dr. McCrory, thank you so much for joining us this evening.
Chris, thank you. It's great to be here.
Yes, sir, man. Appreciate you coming in tonight. Man, one thing I like to do, doctor, is before we get going, I'd like to hear a little bit about you. And how did you end up in the panhandle of Texas?
This is an interesting story. I grew up actually over in East Texas, a little place outside of Huntsville called Trinity. Graduated from there, went to Sam Houston State College there in Huntsville, Texas. Mm-hmm. After that, was accepted into medical school at UT Houston and decided to do my residency in family medicine at John Peter Smith. While there, I was actually recruited to a small town in Central Texas, stayed there for several years, and then started working just mostly from the emergency department. Moved around a few times and, of course, worked various different places. I was actually recruited to this area by a good friend of mine, Dr. Steve Nichols, who actually is one of the VPs of Schumacher, back in 2012 to start coming to the actual hospital here in Plainview to work as an emergency room doctor. Worked here off and on, mostly on, not off, over the last 5 years. Took over as medical director here in 2015.
Okay, there you go. Man, like I said, I always like to hear how people ended up here. And so, you're Texas through and through. So, hey, whether it's East Texas, West Texas, South, or North, man, we're all in this thing together.
This is true.
That is right. Yes, sir. Well, I'll tell you what, folks, we're going to get started with our questions for Dr. McCrory. First off, what are some of the first things you should do when you or someone you know breaks a limb?
This is an excellent question. Usually when someone breaks a limb or you suspect that someone has broken a limb, the most important thing to do is to try not to move that extremity as much as possible. Immobilization is a very key point. There are a host of aftermarket splints, but I've seen everything come in through the emergency department, from cardboard boxes to actual pieces of fence rail being used to immobilize a suspected fracture. Like I said, the most important thing to do is, one, get off of that extremity if it is a lower extremity, or of course if it's upper extremity, quit using it. Try to immobilize it, try not to move it. Ice packs are a very key point because they prevent swelling. Mm-hmm. If there's obviously is a piece of bone that is either sticking up near the tissue or rather is poked through the skin, or if it is tenting, or what we call tenting means that it's right below the skin, then whatever you do, try not to disturb or contaminate that area as much as possible. Mm-hmm. I've had various people say, well, we pulled on it and tried to put this back in place. No. Let's not go doing that. God. Let's make sure we get an x-ray or two.
That makes me sweat just thinking about it.
There's stories abound of people putting joints back in, of people, setting bones before they come to the doctor. Unless you've got a big S on your chest with x-ray vision, I don't think that's a great idea.
Right. I remember, you're talking about setting bones and doing these things. My freshman year of high school, the coach decides to do this drill where they roll the ball down the middle of the floor and the two guys take off and battle over the ball to try to get it. Well, this guy had a compound fracture in his leg, and the coach went to his office and grabbed a magazine and wrapped it around the bone and then taped it around, I guess, like you said, to help immobilize, right, to where we didn't bump it, it didn't get hit. And I remember I remember that like yesterday. So I know that if that ever happens, by gosh, find a magazine and wrap it up.
Well, and there's something to be said for that, because, the paper and the cleaning agents that they use, the releasing agents that they use on the paper of magazines, it contains a lot of acids, mm-hmm, contains a lot of alcohols, and it's more sterile than rubbing dirt in it, that is for sure.
There you go. Okay, great. Moving on to the next question. I was recently involved in a small car accident. I don't know if they were driving a smart car. I don't know if it was a Prius. I'm just teasing. Okay, a small car accident. Paramedics insisted that I put on a big plastic collar around my neck. What was that, and what does it do?
Basically, what they did with you is they put you into something that we call a cervical collar, or a C collar for short. These are minimally adjustable but rigid splints, as they were, for your neck. Frequently, neck injuries are something that will happen even in very low or moderate speed accidents, due to the fact that a level of spinal cord injury at that in the cervical spine can result in either complete or partial paralysis almost of all four of your extremities, and it is such a life-changing event. Some of the older listeners may recall Christopher Reeve and the whole thing that he had to go through after he suffered his fall from a horse. A very similar method. The idea is that we splint this as much as possible to prevent any further neurologic damage. Who and where can this collar be removed? Frequently, EMS, if they decide to put that on, they may decide to remove it at a later date. If they transport you to the emergency room, be prepared to be in that collar for a little while longer. Usually, the emergency room physicians are either going to do what is called a clinical clearance. That is where they actually come in and remove part of the collar and then examine your neck to make sure there's no injuries that they can feel. If you're able to follow directions and are not under the influence of any other injuries or under the influence of any alcohol or drugs, then they may be able to remove the collar without x-rays. Frequently, unfortunately, they do require either x-rays or a cervical CAT scan.
And on those collars, now we're not talking about the same collar that my dog gets so that he doesn't scratch his ears, and that right?
No. These collars are more rigid, and and to be honest with you, if the paramedics are putting them on and they're not uncomfortable, then they're probably not fitted correctly. These collars are not comfortable to wear. You're not going to want to wear this around.
Yeah, it's not the kind of thing where you're just going to get used to it, and
No.
Okay.
No, they're very uncomfortable.
Right. All right. Next question, doctor. How bad does a burn have to be before I should go to the emergency room? For light burns, is there anything I can do to help the pain? I heard that vanilla extract works.
Well, first of all, whenever you start talking about burns, it's kind of like real estate again. It's all about location. Burns that are near the face or where there's a potential for smoke inhalation are very important to get emergency medical care for. Smoke inhalation can happen with flash burns, even very quick exposure, because of the nose is so sensitive, and because the upper airways and even the lower airways are so sensitive to smoke inhalation and to not just the smoke damage, but also heat damage from inhaling the heat from a close proximity fire. That's why you need to make sure that if there's any chance of inhalation, you need to seek medical care sooner rather than later. Other things to talk about, like light burns or small burns, when to seek medical attention. Simply, a great rule of thumb is anybody that has more than a 5% burn across any portion of their body. It sounds like, okay, well, how do you know what a 5% burn is? All right. The burned individual's hand, the actual hand from fingers to the palm of their hand, is approximately 1%. So, of course, if you take the burn victim and you look at their hands, and this is not, obviously, even Donald Trump will, of course, count for 1% of his body with his hand. But the things that you will see is if it's more than 5 hands of that, you probably need to be seen in the emergency department just to make sure that you're not missing anything. Other areas of concern, obviously, genitals, those are a very critical area because of the mucous membrane contact that you can have and the exposure that you may have there. Further things to talk about are the movable parts, like over your joints, whether it's the extensor side or the flexor side, especially over the hands, because as these areas heal, if it is a burn to the flexing part of the skin, you may have issues with that area contracting and you not being able to fully extend your hand. Likewise, the final area to seek medical attention for burn is if you have what's known as a circumferential or a circular burn that completely encircles that appendage or that arm or your leg there. Those burns, because of the fact that you can have a lot of swelling and you can actually have tissue loss that's past the burn, because the actual burn may inhibit or constrict the amount of blood that is flowing into that extremity.
Okay, great.
For the last part, as far as vanilla, I can tell you that a lot of folks have put mustard on burns. They put vanilla on burns. Does it work? Unfortunately, nobody's going to pay for a study to confirm that this is a documented improvement. What I will tell you is that the theory behind it is that it's a salve and that it may draw some of the heat out. Sure, if that seems like something that is logical for a small burn that you really do not want to seek medical attention for, absolutely proceed with that. One thing I will tell you is that a lot of times with these burns, What we use, what the pros from Dover at the burn centers, especially down in Lubbock and over in Dallas, are using now is a lot of what is known as aquifer ointment. This is an actual ointment that you can buy over the counter. It is an excellent first aid burn therapy. A lot of guys may remember, especially our older listeners, may remember the Silvadene, the white cream that would be slathered on basically from head to toe, looks almost like Crisco or like a white butter. We're getting away from that. We're not finding that it was bad for you. We're just finding that it sometimes would be associated with some cosmetic concerns such as discoloration of the tissue as it regrew.
Okay. And I've also read things about egg whites. I know that they say, if you've got chickens at the house, man, go out and get one of those fresh egg whites and kind of rub on there. I don't know if there's been any scientific but who knows? The protein, the albumin from the egg white may be drawing some of the heat away from the burn. Those are maybe more of a comfort measure more than an actual true, it's going to make the burn heal faster. Sure. Okay. Hey, folks, you've been listening to Discovering Health right here on 103.9 FM The Pulse, brought to you by Covenant Health Plainview and South Plains College. We're going to take a few minutes to hear from our sponsors and come right back to have Dr. Beau McCrory answer more questions sent in by you, our listening audience. Have a question you'd like to have answered? Email your question to askforyourhealth@gmail.com. What do employers think about graduates from South Plains College? Let's ask Leslie Hackett, CNO of Covenant Health Plainview.
The students at South Plains College really encompass the core values of Covenant Health Plainview. Not only are they learning the skills to some of the top professionals of their field, they're learning the importance of values, ethics, integrity, and honesty. We are proud to employ many South Plains College students here at our community hospital, and they are some of the key factors to our hospital success.
Contact South Plains College at 296-9611, extension 4302, and take control of your future.
Your home for Houston Texans football is 103.9 FM, The Pulse.
From keeping you healthy to ensuring the best journey into motherhood for you and your child, Dr. Jessica Sherrist is passionate about the health care of our South Plains mothers, daughters, sisters, and spouses. The only female OBGYN in the area, Dr. Sherrist is the perfect combination of knowledge and care when it comes to your gynecology and obstetrics needs. Visit her and her staff at the Covenant Healthcare Clinic at 2222 West 24th Street or call 806-291-5100. Walk-ins welcome and si habla español.
For great music and information on health-related issues, keep it on 103.9 FM The Pulse.
We are back with Discovering Health, brought to you by Covenant Health Plainview and South Plains College, the radio program that answers the medical questions and concerns that you, the radio audience, have emailed in. In-house, we have Dr. Beau McCrory, who specializes in emergency medicine at Covenant Hospital in Plainview. Doctor, let's continue on with our questions here.
For sure.
Dear doctor, the other day, I had a pretty bad fall and bumped my head. I felt weird for some time afterward. What are some of the signs of a concussion, and what should I do if I ever get one?
This is a great question. One of the things that I will tell you is that frequently in medicine, we're seeing guys in the emergency department with what we call closed head injuries. Well, what makes an open head injury? An open head injury is one in which either the scalp has been split or the skull has been split, demonstrating a significant neurologic injury. Closed head injuries can be very subtle. They can be much like the listener mentioned in this, with just a little bit of soft symptoms such as feeling weird or having problems with concentration, maybe even having amnesia regarding that event. Frequently, what we look for in the emergency department, what we call clue signs or hallmark events, such as, did you lose consciousness? If you've lost consciousness, how long were you out? Were you out just a moment, just a few seconds? Were you out for a protracted time period? If you were knocked out, did you have any amnesia? Was the amnesia pretty short acting? You just didn't remember the exact event? Or is this ongoing even now into the emergency department? These are indicators that the brain has been hit pretty strong. Mm-hmm. Now, one of the things that I've heard before in the past is, that other doctors have said is, you've kind of lightly bruised your brain. This is a bad idea for medical professionals to say to people, because the first thing they think is, like a bruise on my arm. No. It is not that way. If you have significant injury to which you actually have a hematoma or a hemorrhage inside of your skull, there's not a lot of room in that area, and that makes for a very significant emergency. Other indicators that we will look at will be, in addition to the altered level of consciousness, meaning that are they talking to you normally? Do they have their personality? Some of the first things that we see is blunting of personality. People won't have their sense of humor. People won't laugh or react to jokes correctly. They won't have the regular standard emotions that you would expect to see from a normal individual. Other things that we ask about are stuff like, did you have a seizure immediately after you struck your head? These are indicators that the brain, again, took a very sharp blow. There was a significant potential for trauma there. Based off of these symptoms, your emergency room doc is going to decide whether or not you need to have imaging of your brain. Frequently, because of the fact that people will have either standing level falls, or will not have an isolated simple head injury, they may end up deciding to do more studies, such as looking at your neck, simply because the neck is where your head swivels upon your body, and it is very common to have not only a head injury but also a neck injury. Getting back into the head injury protocols that we use, again, the questions that we'll be looking at is did you get knocked out? Are you still having symptoms right now? We also look in children, because kids can't really tell us, hey, I don't remember anything before I fell down. What we look for in the age group is in addition to the loss of consciousness, we'll look for vomiting. Profuse vomiting in children more than 2 episodes after a fall can indicate a significant head injury. So as a parent, be aware that you need to watch for the vomiting that may or may not occur after a closed head injury. How long does it take to recover? Well, simply put, depends on how severe the head injury is. If it is just a little pop on the side of the head, you may be almost instantaneous in recovery. Take 2 Tylenol and call me in the morning type thing.
Sure.
Otherwise, it may be more significant and quite severe. Significant, moderate to severe closed head trauma, it may take weeks, months, and there is a small segment of the population which never fully recovers all of their mental faculties.
So earlier you said that sometimes folks will come in, they've had a concussion, and they've lost their sense of humor. Does it ever happen the opposite way, to where if you're a big jerk and you come in and then you're all of a sudden funny and you've got a great sense of humor and you're loving? Okay.
Unfortunately not. Some of our listeners may be wanting to adjust their significant other at this point. That's not going to happen.
Okay. Sure. And we hear from concussions a lot right now, especially, football, NFL. They're looking at 99% of the football players that have retired. Just recently we heard about a guy donating his body to science. They checked his brain, and he was full of this, whatever that chemical was that is put off. The brain, as it heals, we're finding out the brain, it does heal, and as it does so, there may be specific hormones. There's also specific body marker levels and even scar tissue that forms in the brain of these individuals who have suffered closed head injuries. And as we're discovering, especially, you may have heard of the concussion protocol or a closed head injury protocol, especially amongst contact sport athletes, that these concussions or these closed head injuries can be additive, especially if you go back in and you're concussed in a very short amount of time after the last one that you just had. Your concussion symptoms may be more severe the second or third time. There's also cases in which people have suffered from brain edema and even death from a second or third concussion when they were released to go back and play sports a little bit too early. So we gotta watch those boys. I know we're coming up on 2-a-days. Right. Those 2-a-day practices, man, are going to be starting up pretty close. Got to watch those kids close. Absolutely. Don't forget about the women and the volleyball. Sure. You're going volleyball. It's not a contact sport. There's a lot of contact. Usually it's with the floor or with another player. And if you think about it, volleyball players, basketball players, they have absolutely zero protective gear on usually. You're talking knee pads, elbow pads, and that's about it. So a quick fall onto the floor by one of these players is very significant, very traumatic for them. Thank you, Doctor. Hey, folks, you're tuning to Discovering Health, presented by Covenant Health Plainview and South Plains College. We need to take a few moments to hear from the fine sponsors bringing you this evening's program right here on 103.9 FM, The Pulse.
Health Radio with the beat. 103.9 The Pulse.
Wow, can you believe it's time for back to school already? Now don't panic. IIC Finance is here to help. Call 293-2591 and you could be approved for up to $1,300 in as little as 15 minutes. And because we're ready for some football, IIC Finance has partnered with Great Plains Furniture to help you get that new LED or plasma TV you deserve. Then sit back and watch your favorite team in the comfort and style of your new Catnapper recliner. Choose from in-store credit, layaway, or rental purchase and get it your way today. Come by 108 West 8th Street, your yes address for the cash you need, and get it your way home furnishings. Or call 293-2591 to get the cash you need today with a loan from IIC Finance. And don't worry if you don't have credit, or maybe your credit isn't so good. The friendly folks at IIC Finance can help you to establish or re-establish your credit. Get your wallet and your home ready for back to school and football season at IIC Finance and Great Plains Furniture.
Learn to live a healthier life. Listen to daily health programs here on The Pulse, 103.9 FM.
Don't let pain slow down your life. With our talented orthopedic surgeons, Dr. Joshua Rollins and Dr. Benjamin Farr, your future with pain-free movement is just around the bend. Providing advanced medical care in the comfort of your community, Plainview Orthopedics can help you regain your life. Rollins and Farr specialize in the full spectrum of orthopedics, from arthritis and joint replacement to bone fractures, sports medicine, pediatric care, and injections. Plainview Orthopedics, 806-291-5170.
We're taking questions with Dr. Beau McCrory, who specializes in emergency medicine at Covenant Hospital Plainview. The program is called Discovering Health. Our mission is to answer questions that have been submitted by you, the listener. Now, let's get back to the questions. Dear doctor, I work outside most of the time, and many days the heat is overbearing. What are some of the signs I might be having a heat stroke?
This is a great question, especially now that we're in our the dog days of summer, as they were. One of the things that I'll tell you is that a common misconception is that, oh, well, if it's not 100 degrees outside, I can't get heat stroke. Mm-hmm. That is actually false. Most cases of heat exhaustion or heat stroke happen whenever the ambient temperature outside is only about 85 degrees. It is because there's a function with how much skeletal muscle movement you're doing, how much movement or how active are you outside, coupled with the ambient temperature. And of course, you throw in the fact that sometimes on the very humid days or in very humid areas that you're not getting cooled off by sweating, mm-hmm. which just leads to more sweating and causes more problems. Frequently, we'll see that there's a strong clinical correlation between heat exhaustion or heat stroke and lack of fluid intake. Mm-hmm. A lot of folks worry about their salt levels, make sure that you take salt tablets if you're working outside in the heat. I find that to not be the defining point. The biggest problem that we're seeing is just not enough fluid. I've heard from other places that, you need 8 ounces for every hour of outside exposure. I will tell you it's probably more than that. Okay, mm-hmm. Once the temperature starts breaking 80 degrees consistently, if you're not pre-hydrating before you go outside and work out or before you go outside and do manual labor, you really need to be drinking a lot of fluids, 16 to 32 ounces an hour. Mm-hmm. If you're not having to stop what you're doing every hour to 2 hours and go and take a potty break to relieve yourself from a urine standpoint, then you're probably not getting enough. Mm-hmm. The other things to talk about, some of the symptoms that you may start to experience, minor heat exhaustion or heat exposure, you're going to start having, of course, a headache. You'll start having problems concentrating. You may lose some of your fine motor skills. This is critical on guys that are outside doing construction or outside baling hay, threshing wheat. These are very sharp objects that these guys are dealing with. If you think about it, think about some saws, think about maybe the threshers. Things are going to go bad for you if you don't have very good control of your extremities and very good fine motor skills. Likewise, you'll start to see some slurring of speech. You'll have a horrible, horrible, unrelenting pounding headache. You may find yourself to where the bright light bothers you, what we call photophobia. Other things and other symptoms that you can find as the heat exhaustion progresses is that you may stop sweating. Stopping sweating outside doesn't mean that you're becoming acclimated to the heat. Mm-hmm. Quite the opposite. That means that your body has run so low on free body water and you're becoming so dehydrated that you're actually now causing your body to shut down, and you will rapidly overheat without sweat production and performing evaporative cooling.
And in talking about this, how long does it take after I drink 16 ounces of water for that to actually go into my system and begin to help me?
That's a great question. One of the things that we found is that it depends on how much food you've had. Okay, if you eat a huge, big, greasy breakfast, I like my extra bacon, I like my extra sausage, you're going to have a slower amount of absorption rate because the fat is going to slow down the amount of absorption that you're doing from your stomach. On the other hand, if you're drinking water with a light breakfast or with no breakfast at all or just drinking water on an empty stomach, it's very quick on your absorption rates. You can see a lot of water absorption within 30 minutes to an hour. Water is taken up readily by the stomach and by the first portion of the small intestine mucosa for quick utilization by the body. It's almost like when God designed us, he made sure that we had that capability of rapid rehydration.
Okay, doctor, final question. What do tetanus shots protect you from, and how often should I get one?
Great question. One of the things you're going to hear all the time is if you ever cut yourself, you end up in my ER, one of the first things my nurses or I will ask you is when was the last tetanus shot you had? The magic number that we're looking for here is a shot for most individuals who are not involved in healthcare. It needs to be within 10 years. So the magic number is 10 years. If you had a shot, think about it, 2007 or after, you're good right now. Now then, of course, you need to kind of make up for that and understand that if you cannot tell me when your last tetanus shot was, you're going to get one that day. And the reason is because tetanus has a couple of things that is protected from with a, quote, tetanus shot. Almost all tetanus shots now have either 2 or 3 different components to them. The first component is diphtheria, which is a bacterial infection that you can acquire. It was rampant through the 18th and 19th centuries, and with the advent of vaccinations, you very rarely are going to see somebody with pseudomembranes in the back of their throat or with coating of the back of their throat consistent with diphtheria. In fact, I've never seen one. I've been doing this almost 20 years, and I've never seen a case of diphtheria. There's talk of, folks wouldn't be able to recognize it if we saw it, if we had a case of it. The other things that you get into with it is the tetanus itself. Tetanus is a actual bacteria that grows mostly in the soil. Everybody thinks of what? A rusty nail.
That's right, rusty nail.
That's what everybody automatically thinks of. No, it's not the rusty nail that you have to worry about. It's any contaminated surface, whether it be a piece of glass, whether it be a piece of metal. One of my biology teaching assistants, whenever I was in college, actually ended up with tetanus from a cut that he sustained while using a scalpel in one of the feline labs, in one of the anatomy labs. So it was a very much an eye-opening experience for all of us in understanding that you must keep your status up to date. Old folks would call it lockjaw. There's very dramatic pictures. If you ever want to Google or show people interesting photos, there's several photos from the 1800s and early 1900s in black and white of specifically one gentleman who was in the end stages of tetanus, and literally all of the muscles in his body are tensed up, and the only thing that's touching the bed is the very tip of his head and the very bottom of his heels. I mean, everything in between is completely arched up, and this guy could not relax at all. That's the end stages of tetanus. There's not a lot that you can do at that point. I mean, because it's not the bacteria per se that is causing the problem, it's the toxins that the bacteria may make is what causes the problems with tetany. The last thing is when you start talking about the other type of the tetanus shot, so that's what is known as a TD or a DT, depending on which manufacturer this week or which governing board you're talking to. Will tell you that that's a TD or T or DT type vaccination. The last vaccination concerning tetanus has a P in it. The P is pertussis, whooping cough. We've seen a huge development of whooping cough coming back, especially in our population of the elderly. It seems like it's a reservoir. And is it because these individuals are not being well vaccinated? Simply put, we just don't know. I will tell you that those 2 types of vaccines are the ones that you'll most commonly see that are being administered by healthcare professionals today, though.
Okay. Thank you, doctor. So, get out there and get your tetanus shot.
Absolutely. And do it sooner rather than later.
That's right. Hey, well, it's about time to wrap things up. I'd like to thank Dr. Beau McCrory, who specializes in emergency medicine at Covenant Hospital, Plainview, for being here with us. Have a medical question or concern that you'd like to have answered? Drop us an email at askforyourhealth@gmail.com. For HPRN Radio, I'm Chris Moore. Stay healthy, my friends.
Lord God, we just thank you. We thank you for using us to provide comfort, encouragement, and hope to others who are suffering. Lord, we thank you. This is Sherry Wall, Covenant Health, Plainview.
You have been listening to Discovering Health, presented by Covenant Health Plainview, with host Chris Moore, and exclusively on 103.9 FM, The Pulse. Do you have a specific problem or question that you want discussed? Email your question to askforyourhealth@gmail.com. And listen in every Wednesday at 5 p.m. for Discovering Health, presented by Covenant Health Plainview. The information discussed on the show are for informational purposes only. The purpose of the show is to promote understanding and knowledge of various health topics. It is not intended to be a substitute for diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment. Thank you for listening to Discovering Health on 103.9 FM, The Pulse.
This is my favorite station, KRIA 103.9 FM.
The Pulse.